Victoria. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment on you. And so I'll be checking your chest and your heart and your lungs and your abdomen. Is there any kind of concerns you have before we start?
No.
All right, so let me check your blood pressure first.
Okay.
So let's do the left side. And okay, kind of wrapped up. All right, just relax that there. Okay, it was 118/76, so really good. And I have a couple of silly questions to ask you.
Okay.
Do you know where you are today?
Yes, at the doctor's office.
Perfect. And can you tell me your name?
Carrie,
And what day is it today?
February 12th.
Perfect. So my patient is alert and oriented ×3. And I'm just going to do a little external check on your eyelids, which seems normal. No lesions seen, and eyelashes and eyebrows are healthy and full. And I'm just going to check with my pen light here your pupils. So
Okay.
just look straight ahead. And also conjunctiva and sclera are white and quiet. And pupils are round, reactive, and equal. And now if you can look at my pen light and just follow that as I come towards your nose here. And accommodated well. And I would say the pupils are about a 3 millimeter, or I would say 3 millimeters in diameter. And also let me check your lips here, which are pink and symmetric. Now open, and let me check inside here. So gums are healthy and pink, teeth are intact, and if you can stick your tongue out there with your mouth open. And now perfect, if you can actually flip down the lower lip there. And mucous membranes are all intact, no lesions seen. Okay, so let me check your ears. So externally, everything appears to be normal, no lesions, and healthy. Okay, so now I'm just going to check your trachea here. So
Okay.
I'm going to feel on there, and everything is symmetric. And now I'm also going to check your pulses. So your carotid pulses here are both equal and 2+ bilaterally. I'm going to check your skin turgor, which is perfect. Quick response, no signs of dehydration. And I'm going to check your arms. If you can pull them out here like this, perfect. And no signs of any bruising, cuts, lesions, skin's even tone, no jaundice, no cyanosis, and no pallor. And skin appears to be warm, smooth, and dry. Perfect. And fingernails are healthy, pink, and flat. Capillary refill rate is about less than 2 seconds, which is perfect. And I'm going to check your pulse here. And radial pulses are 2+ and equal, so that's really good. Now one more test here. If you will squeeze my fingers here at the same time, really hard, which is good, and that's a 5 reaction, normal, strong, or normal strength. And so now I'm going to have you sit up a little bit. So I'm going to check and see the position of your chest from anterior to posterior is symmetric. And I'm going to also now start your heart sounds. So just breathe normally. And we're going to start with the second intercostal space on the right sternal border, which is the aorta. And then I'm going to move over to the left sternal border, second intercostal space, which is the pulmonic sound. We'll move down to the third intercostal space, Erb's point, left sternal border. And we'll move down again to the fourth intercostal space, the tricuspid sound, and still left sternal border. And now we're going to move to the fifth intercostal space, the medial clavicular line, which is the mitral. And there are clear and distinct S1 and S2 sounds, no sounds of additional heartbeat, no murmur sound or splitting, no splitting. And I'm going to listen to your apical pulse for a full minute. So I'm just going to sit here and hang out for a little bit while I get this pulse measurement. Okay. So mid. Okay. Okay, very good. I got 72. That's normal. And I'm going to actually do the same thing again, but this time I'm going to listen to my bell side. So let's do the heart sounds one more time. Okay, so we'll start with the mitral again, which is the fifth intercostal space and the medial clavicular line. Okay, and we'll move up to the fourth intercostal space, which is the tricuspid and the left sternal border. Okay, we'll go up one more to the third intercostal space, Erb's point, left sternal border. We'll go up one more to the second intercostal space, which is the pulmonic, left sternal border. And we'll move across the sternum to the right side on the right sternal border, and that is the aorta. Okay, those all sound good as well. Still complete S1 and S2 sounds, no signs of not stripping, it is splitting, and no extra additional heartbeat sound heard on the exam. And so now we're going to do the lung sounds. So I'm going to go to a couple points here in your chest, and if you can just breathe a full inhale and exhale each time.
Yeah.
Okay. You can lift your arm actually, let's do this. Okay, let's do this side. Okay, very good. So there was clear and present breath sounds in each lobe, and there was no adventitious sounds like wheezing or rales or bronchi heard. And I'll do the back side, do a couple more areas. We'll do the same thing. Okay, now be ready. Okay, really good and clear. Still no adventitious sounds like the wheezing, bronchi, or rales. And all right, so now I'm going to have you actually gonna lean back here. Gonna move you down to supine position, 30 degrees. There you go. I'm gonna lift these legs up. There you go. We'd be on a bed, usually. And I'm going to check and see how her harmonic is here, which is not heaving or lifting. And at this point, I would actually raise up the gown and check her skin, but for this, we're not going to do that. But it looks like the abdomen is even tone, flat, no signs of any lesions, no signs of any peristalsis. And I'm going to listen to here. Okay, and she has normal active bowel movement or bowel sounds in all 4 quadrants. And I'm going to do a light palpation with my hands. And if you can tell me if this has any tenderness to it in any of these places. No. Okay, so no tenderness seen on exam, and no masses or no types of guarding noted. I'm going to do the same thing but a little harder this time. Just a little deeper. Okay. Hurting at all? No. No tenderness? Okay. No tenderness, no palpable organs, no guarding, and no masses seen again. So now we're going to move down to your legs, and I'm going to lift these pant legs up, and skin on legs seem even tone, normal, no lesions, no cuts, no bruises, no cyanosis, pallor, or jaundice. And that is true for the posterior sides as well. And we'll just check the pretibial edema on both sides. And we'll hold these here for 5 seconds. And 0 results, so no pitting edema. And now, I'm gonna have you take off your shoes here. Okay. I'm gonna put gloves on as well. So now I'm going to check for pedal pulses. Pedal pulses. Dorsal pedis pulses, I'm sorry. And they're both equal bilaterally and 2+ strength. And I'm going to check on these little toes, which are all healthy appearing nails, pink, flat, and the capillary refill rate is about less than 2 seconds on each one. Okay, we're gonna do one more test here. If you will, push against my hand at the same time as hard as you can. Perfect. And that was a 5 strength result. Okay, you please can stand up. Okay. I'm going to check your spine. I'm gonna wash my hands. Okay. So, we're going to check her spine here, and you will actually turn this way. Now, if you can bend forward at the waist with your arms just hanging down, I'm going to touch on your spine. And any tenderness noted here?
No.
Okay, so no tenderness and no signs of scoliosis, lordosis, or kyphosis. So perfect. Very normal, very healthy. We're all finished there. I'm going to wash my hands again. You can have a seat. Okay. Okay. And do you have any questions for me?
No, I do not.
All right. Well, thank you so much for letting me examine you today. You've been a great patient.
Thank you.